Hello, today is October 9, 2024, and I'm recording this video while Hurricane Milton is going over us, wind is picking up, and house is making a lot of noises, and probably in the background you may be able to hear some noise. With hurricanes becoming more frequent and intense, you should be prepared, or you should learn how to get prepared for physical damages which hurricanes do, and above all the medical impacts it has not only on acute diseases, chronic diseases, and by disrupting our healthcare delivery model. There is a lot at stake, and I am going to be presenting you in this video both immediate, short-term, long-term effects of the hurricanes, and we will come up with practical solutions so that we could prepare ourselves during this hurricane and also going through what future holds for us. As global warming is happening, hurricanes are prevalent and they look like going to be more intense, and we need to prepare. What is hurricane? Hurricane is a lot of fast-paced air or a wind which is circulating plus lot of water. So it does wind damage and also bring lot of water. With damaged infrastructure of our houses, mobile homes, or any building we are, plus water having a tendency to seeping into our infrastructure produces the unique combination of acute destruction and long-term healthcare complications. The biggest thing after we survive the impact of air, which is depending on the category of a hurricane, you are from category 1 to category 5 between 40 to 165 miles per hour. Once you survive the acute damage by the hurricane, then you're left with broken houses, lot of mental stress, lot of electricity, water, power, gas, and lot of spoilage of food, home, and above all, short-term and long-term consequences on your health, both physical and mental, because this recipe leads to worsening of your chronic medical problems and also lead to a lot of mental tension and stress. Flooding is one of the biggest issue. Usually in United States, we see a lot of flooding, but not to the level which we saw in hurricanes or what we call typhoons in Philippines and other countries which they bring. I have pictures, and one of my colleagues had water up to their first floor and they survived because they had living space at the second floor, and it took months of hard work to clear it. So flooding usually in United States is short term, but it does happen, especially in the low-lying areas on the coast like Tampa, where it is below sea level. We may see significant flooding, and we will discuss about what flooding does. Flooding leads to two problems. Number one, acute physical damage due to flood, excessive water, and also waterborne diseases like leptospira, hepatitis A, giardia, lot of skin infections, and multiple respiratory infection flare-ups. They happen due to flooding. Now, as I said, we have three categories of distinct problems which are associated with hurricane. Acute problem, which currently while I'm recording this video, when the wind is pounding, water is being thrown on our houses in buckets, we are going through acute problem leading to a lot of physical damage of our property, lot of anxiety, depression, and a lot of people will be left with post-traumatic stress syndrome, and above all, worsening of chronic medical problems. Yesterday, I have sent almost prescription for 40 of my patients who have COPD, heart failure. We have provided them the prescription preemptively, like if their lungs flare up or their heart failure flare up, because once you are not in a normal circumstances, all your chronic medical problems will get worse, and we will take them in detail. Short term, after the hurricane is over or is going through, there is this very big possibility we will lose electricity, air condition, transportation, and above all, we will have very limited access to healthcare services. EMS, fire, hospitals, they're not only going through the damage by the hurricane, they also have to keep the essential services live. So the whole system will be stressed out. And long-term problems from hurricane is mold, post stress distress syndrome, and also the financial losses, which are in millions and billions of that. Whenever there is extra water when you're flooded, hopefully we don't see much of this in the United States, but rest of the world, we got a lot of waterborne diseases. And the feared one is cholera, leptospira, giardia, novovirus. Then when the water accumulates on those areas, there is a lot of mosquitoes leading to malaria, dengue fever, Zika, and then the quality of the air gets worse. Lot of people, and then in the crowded spaces like shelters leads to a lot of influenza, and then respiratory infections, including COVID. So we have a water problem, air problem, and then from the collection of the water, a lot of pathogens which we arise out of that. Impact of mental health or impact of hurricanes due to all the coping mechanisms, all the stress and constant anxiety, whether my home infrastructure will hold it and I will be safe, causes a lot of anxiety, depression gets worse, and lot of PTSD. This is not a simple mechanism. Like we have gone through many hurricanes in the past. The mental health component is not fully recognized by system and healthcare facilities and also by the physician. And above all, nobody can compensate you the trauma which you are going through this at this time. God forbid if we lose one of our family members, it will be traumatic for rest of life. Effect of hurricane on chronic medical problems. Diabetes is one of the very particular one. During hurricane season, our food intake, usually we go to ready-made processed foods. Our sugar gets high. And then if we lose electricity to refrigerate or keep our insulin, Ozempic, or any other medication at a proper temperature, that gets affected. So most of the, and then you combined with stress, you will find your sugar is running very, very high. Due to severe anxiety and depression, there is a high likelihood of cardiac dysrhythmias, and also there is a slight increase in having heart attack and stroke. Lot of people get a lot of respiratory infections. This air is now picking up all the dirt, weather, chemicals, and is circulating, is going all over. So there is a lot of flare up of respiratory infections and problems. GI symptoms, psych symptoms, all systems of your bodies will be stressed out. And the only way we will survive through that is I know you all have done very well to ensure you have adequate supply of medications. There is executive order that you could call your pharmacy and get 30-day supply without any questions and concerns. You will be able to get it. And we as healthcare provider are standby to help you take care of your chronic medical problems. We want to ensure that you do not use emergency room and do not initiate 911 services unless it's absolutely needed. If you need it, definitely they are there. But we want to contribute to ensure that the preventable reasons or preventable calls and preventable overload, if we could avoid, we want to do that part. While we have been sending you the messages how you would or could have prepared for the chronic medical problems or in future it happen, make sure you have adequate supply of all essential services. And if you use devices which needs power, because you know the chances of losing power is very high, you must have alternative emergency arrangements. And if your infrastructure is not strong enough or you're in a mobile home, you should find the nearest relative or shelter and make sure your important information is either digital or you saved it properly. and then be in touch with your primary care physicians. We have published our phone numbers. You have a telehealth. We will go to any extent to help you with that. One of the very common medical problem which we see after month or 2 months after the hurricane is mold. When the infrastructure is shook up, water seeps out, it requires moist, damp environment, and there is a lot of mold or a fungal infection happen. That leads to very frequent respiratory infections, skin infections, flare-up asthma, and those are very, very common. Make sure that we all keep on inspecting our homes, that there is no mold, because if you have it and you have respiratory infection in the past, you are bound to have some medical problems, and we want to make sure that your problems are taken care of wisely and properly. Healthcare systems. Today, you call any emergency room or hospital, they are working at capacity. Problem is during hurricane, their teams cannot freely come and go. So all the healthcare workers, they are working overtime, but they are trained professionals. They will do anything to keep you safe. But it is also our responsibility to use these services properly. Further, like any other building, hospitals usually are very sturdy, but they could have some damage due to these fast winds. You will find that your ongoing care, like chemotherapies, radiology, scheduled surgeries, outpatient procedures, they all will be disrupted. Make sure you communicate with your doctor, keep yourself safe, and then they will do everything to ensure your care and continuity of care on a going basis. We have compiled a lot of data from you guys, and then there were 10 most common questions which were answered over and over. With this background so far with this video, I will answer those 10 questions. First question was health risk after hurricane flooding. Once you have flooding of your house or your surrounding, you have two kind of problems. Number one, with flooding, there is a lot of waterborne pathogens. Those I mentioned before, leptospira, giardia, coccidia, hepatitis A. Fortunately, in United States, these things happen very rarely. They can, but they happen very rarely. But in other countries where infrastructure is not as strong and public health is not as strong as us, this is a real problem. Then from collection of water, a lot of mosquitoes happen and they lead to a different set of problems. Dengue fever, malaria, Zika virus, and West Nile viruses. Those viral infection can problem. Second question, diseases caused by hurricane flood. Those are waterborne diseases like leptospira and hepatitis A, and then giardiasis, and then vectors which are growing on the collected water, Zika, West Nile, and typhoid. All of these things are very problems. Question 3, how hurricanes affect mental health. Hurricanes definitely cause a lot of anxiety, definitely make a lot of people depressed, and also a lot of us will be left with post-stress distress syndrome. Anxiety is because the threat is real. This is not a imaginable threat. When you are going through a hurricane, especially in the coastal area, where wind is more than 100 miles per hour and you have very weird noises, your house is making, you can hear outside, you see with flying debris, that bound to make you anxious. But we are Floridians, we are human, we will survive. Next, lot of depression. Depression is because all the chronic medical problems are getting worse, financial risk, and then we all worry about each other, trying to make sure that our loved ones are there. There is a lot of worsening of depression. And above all, PTSD, which I have talked to you, it is a real phenomenon, and there is no way it is very well recognized in our healthcare system. But we have a very robust healthcare system. We will get through that. We will deal with whatever we have to deal with that, and we will survive. Next question, hurricane preparedness for chronic diseases. As we did yesterday, number one, make sure your medications you have adequate supplies and they are in a very safe place. Number two, ensure if you need power for your devices, you have alternative resource. Number three, which is very, very important, is to have a direct contact information about your medical practices and providers. Number four, you should have information for local shelters and social environment. I've seen through previous hurricanes, and I'm pretty sure this hurricane will not be different. As a society, this brings the best out of us. We all go out of our way to help you, support you. I am not afraid that this hurricane will leave a mark on us. We will survive. We are resilient. But yes, it is a real problem. Next question, which came by many patients, was how hurricanes affect asthma. As I did yesterday, we have sent a lot of prescription for steroids, inhalers, and antibiotics in case they need. Because the quality of air will be very poor, you are born to have triggers somewhere in the wind, yet your asthma may get flare up. If it does, I hope the medications you have will help you and you preemptively start taking the medication so that it does not become a problem. But if you are asthmatic, you may have increased risk of having asthma. As we have been preparing for last many days, we have vaccinated most of our patients, and you will find all these preventive measures, they are helpful. Hurricane and waterborne diseases. I think I have covered it in detail. Please refer to the as question number one, which we have done it. But just passing remarks, you will have lot of bacterial, viral, and vector-borne infections when there is flooding. Hurricane mold exposure and health risk. I think that is something which is not as much appreciated like mental health. Mold really becomes a real problem once the hurricane is gone. I would strongly say if you start having more frequent respiratory infections, skin allergies, you must do everything to inspect your home, have your insurance inspector come and look at your house, and then talk to your physician and they may be able to give you some healthy tips. Impact of hurricanes on healthcare system. Our healthcare system is very strong and robust and very, very resilient. Our hospitals will do everything to accommodate you and ensure that you have no complications. But at the same time, we must use healthcare system wisely. I'm very sure our 911 services, EMS services, they will do everything to get you to a safer place. But ensure everything that when you call them, you really need them. And if there is something preventable, call us, take care of yourself. I think with these background, I hope you understand that hurricane has immediate effects, short-term effects, and long-term. Immediately, we are worried about your bodily safety, your property safety. You will have a lot of wind damage, you will have a water damage, and then the water collects waterborne diseases, worsening of your chronic medical problems, combined with financial stress, a lot of anxiety, depression, and healthcare systems stress to the maximum. But hope is we all are very resilient. We'll use the resources wisely. We'll get through that together, and I hope to see you at the other end, happy and healthy, what we are intended to do. Thank you very much. If you need more questions or concerns, please comment and I will answer those questions. Thank you very much.